My name is Paul Nuki. I'm the Global Health Security Editor at the Telegraph in London. And I'm a long-time follower of all things Gavi, and a long-time follower of the COVAX initiative. I wrote extensively on COVAX and the effort to vaccinate the world during the pandemic. So I was especially pleased to be able to read what is the top-level findings in this report. I wanted to start simply by saying, or reflecting what the report says, which is it is critical to acknowledge that COVAX was a global first, and it was launched into a highly charged, dynamic, and very fast-moving environment. I don't think that there's any doubt about that, and I don't think that there's any doubt about the program's achievements. 1.95 billion doses of vaccine over the 2 years of the pandemic, 146 countries served, and it's estimated by Imperial College in London that there were 2.7 million deaths averted by the COVAX initiative. So I say that now, not because there are not criticisms of it, there are, but just to give you that context, so that the whole thing is not defensive in its nature. So if we could go round each of you first, starting with Aurelia, introducing yourselves and giving me your very brief view of the overall outcome of this study, and anything you think it missed or want to draw particular attention to. So over to you, Aurelia.
Thank you, Paul, and thank you very much for convening us. So my name is Aurelia Nguyen. I'm the Chief Program Strategy Officer at Gavi. I was also the Managing Director running the COVAX Facility from the start of the COVID-19 epidemic up until recently. And so, I mean, I think on the report, well, first let me start by saying thanks to the evaluators. It's really good to have what is, I think, a thorough job in terms of how we complete our understanding, I think not just of COVAX, but I think of the whole situation. And to answer your question, Paul, I mean, I would agree with you. I think the headline findings in the report are strong. I would particularly call out how they highlight the need in future for access to finance upfront. Couldn't agree more there. About needing a mechanism that's designed well in advance with a strong governance around the fact that every region and every country in the world needs to have access to vaccine manufacturing. So very, very much aligned with the evaluation findings there. There's one point that I thought was interesting around being ambitious. And in a way, this is an interesting finding because from my perspective, I don't make any apology for having worked on something that was highly ambitious because of everything that we had learned going back to 2009, for example, with the H1N1 and how the world fell really short, not just from an equity perspective, but also from a scale perspective. So I think for me, that one is one that I think we ought to have been ambitious and we should continue being ambitious on.
Okay, thank you very much there. If I could just move on then quickly for a summary view to Leah Tadesse, a health minister, so a real recipient of this important project. Could you sum up for us what you think of the report, please?
Thank you very much. Again, brief introduction. I'm Leah Tadesse, Minister of Health for Ethiopia, but I've also been engaged in the process as a COVAX AMC engagement co-chair with Indonesia and Canada, as well as a Gavi board member. So I've been closely working with the COVAX facility, and in addition to being, of course, a country recipient. And I want to say, also appreciate the evaluation done, especially on the 5 pillars, which are really critical, and also echo what was said in terms of the strengths, in terms of especially how fast it was established using existing mechanisms to address this global challenge. Overall, I feel like the study has shown the strengths and has also pinpointed issues that could have been stronger and should be looked at in the way forward. And particularly for me, especially as a country, the issue that vaccine deliveries were planned ambitiously and were aggressive, but were delayed was the main key issue. If we say that we should look for ways to mitigate that in future pandemics, especially how the deal was a bit focused in one organization primarily. Most of our funds going to that at the initial stage through SII, and that was causing the bottleneck to move forward. Because for countries, it was not just a delay, but it also reduced the momentum of people wanting to receive vaccines. So it had an impact. So I think it has clearly outlined what could be done better in terms of market shaping, having accountability in those areas going forward.
Thank you very much. Beth, you represent one of the world's biggest donors, perhaps the biggest, I imagine. Could you tell us what your reaction is to what is admittedly just a high-level report for the moment?
Sure. And really, the evaluators did an excellent job of speaking with a wide variety of stakeholders. They really dug deep and got some pretty frank responses about both the successes of the mechanism and also the challenges. I would say just a couple of top takeaways. The first is that for all its many flaws, and the evaluators do a very good job of going through that forensically, if there had not been a COVAX, you would have had to create a COVAX. We could have not gotten as far as we've gotten without COVAX. So certainly there are many challenges, and we have to figure out a way to rectify those challenges for the next pandemic or the next wave of COVID. But if there had not been a COVAX, we would have had to invent one. And I think that the team that carried it out under a staggering amount of pressure in a very short amount of time. It was a massive and complicated mission, really unlike anything we've ever done before. A couple of other takeaways. The second one I would say is really the need to focus on delivery alongside supply. That came relatively late, and I think it led to a lot of consequences that hopefully we have some time to talk about a little bit later on in the hour. But that's something that's shown very brightly for me, that we need to focus on delivery from the start, as opposed to it being something we think about only after vaccines are sort of making their way to tarmacs. And then I think a couple other things. The first is surge financing. We need surge financing for procurement and delivery, and we need that available before the crisis hits, as opposed to trying to mobilize it when the crisis is upon us. Obviously, the resource mobilization is a big success of the COVAX operation, but it shouldn't have had to be that way. There should have been some financing in place early on. And then finally, I think overall, my key takeaway is that we need to do better at operationalizing equity. It was obviously a big pillar of everything we were trying to do, but we fell short as a global community of operationalizing it. And obviously, there are various reasons cited in the report, but I think a lot of the conversations that are happening now in the G7, the G20, the INB, around how to actually operationalize an equity agenda globally and how to have better solidarity, more articulated solidarity among countries on issues like this is really important.
Thank you very much. And then Lisa, you represent the core participants for the scheme, a diverse group, a big and diverse group. Could you give your summary, please, and particular points?
Absolutely, and thank you to the evaluators and really to everyone that worked in the COVAX mechanism. I represent the civil society aspect from the Gavi Civil Society platform and steering committee, and I had the pleasure of being the COVAX co-chair. So we recognize that civil society in the report was engaged, but it might have happened a little bit later. And it ties into really that vaccine demand, the COVAX design, and service delivery. Many think that CSOs or civil society organizations are only there for advocacy, and which is very true in terms of replenishments, in terms of getting messages out and the communication piece. but it is also civil society. There are frontline implementers, especially in fragile states. And so involving them in a meaningful way in strategy design, in some of the conversations, not as listeners, but as actually actual participants. And that equity issue brought up by my colleague at USAID, really having more country voice in civil society, having them be able to activate communication and messaging for vaccine demand, and have it more country driven so that there would be more vaccines going to the country level from a global point of view in terms of donations and price points. I think there is a lot more that can be said, and I think there's a broader report that will come out. But the effort, this report only reflects till about 2021. And we know that since that time in 2022, there's been a lot more civil society engagement in terms of the discussions on manufacturing, consultations on financing, and what's next in terms of COVID-19 and integration and immunization.
Okay, thank you so much. So a few specific questions from me, maybe to prompt a broader discussion so people feel willing to jump in. Beth, you clearly think, if I'm not putting words in your mouth, that this was value for money. But one of the findings of the report is that the facility could have taken more risk early on to engage vaccine producers and secure supply. It's a funny thing, perhaps, for a public good like this to be told it should be taking more risk rather than less. Maybe we'd like to comment on that for us as a representative of the biggest funder.
Sure. I mean, we are the biggest funder of COVAX, and we sit on the Gavi board as well. I will defer to Aurelia on the specific considerations that were being made inside the organization on risk. But I'll say it's a tough road to walk between too much and not enough. And I think that this is a situation where perhaps in hindsight, it's much more clear that there should have been more risk taken than it was at the time, given that this was an unprecedented operation. I think that that what we see now, that obviously the pandemic's not over, but we do have a bit more time to pause and reflect. And all of these conversations that are going on in multiple fora right now about medical countermeasures and how to secure access to them are all taking into consideration the need to take risk at the beginning of a crisis to ensure that you can respond in a timely manner. So I think that regardless of whether there should have been or there shouldn't have been early on, hindsight is 2020. And now we need to take that 2020 hindsight and actually plow it into making smart decisions for the future, setting up the kind of ecosystem that's going to ensure very quick access to these medical countermeasures, such as vaccines, especially vaccines going forward, but also other medical countermeasures. And I think that an assumption of risk is part of the calculation in talking about this ecosystem that we need to ensure gets set up.
Thank you very much. Leah, you talked a bit about delivery, and it's one of the findings of the report that not enough attention was placed on the delivery of the vaccine in the field. You look after health in Ethiopia. Have you got ideas as to how we could fix that in future? How we make sure that delivery on the ground works better?
Yes, it was initially, of course, assumed that the existing systems would automatically deliver the vaccines once they are available. But although it did not support in the initial phase, what came later as the COVID delivery support mechanism was really key. Of course, initially also there was support in cold chain expansion and other key system issues that can support, but actual delivery support gap was identified a bit later. So the mechanism, of course, was quickly established as well. So it was very instrumental in enhancing later on the expansion of delivery, even once it reached the countries, to make it accessible to the communities. So because these kinds of pandemics, they require it's very different communities we are addressing outside, or when you compare it to the routine immunization. This is mostly adult vaccination, and that's very different. And it is at scale in a very short time. It requires really huge resources. So I think the learning was that it should be designed from early on how we deliver at scale, but with strong communication as well, that can keep the momentum going. So what happened later on, in addition to supporting the system in like expansion of cold chain and others, was very instrumental, but it was, as was mentioned in the initial phases, it was delayed and may have delayed some of the delivery that was seen. Even after a vaccine access was improving, we have seen that.
In the UK, where not everything went well, but our vaccine delivery did go very well. And people say that that is because we've got a centralized health system and everyone really is on a digital register, therefore. I wondered what you thought about the creation of digital registers across the world. Would that help in rolling out this sort of initiative?
Well, absolutely. That would help going forward. I mean, digital solutions is what we have seen was very instrumental in communicating, at the same time tracking and enabling the delivery to be faster. But we have seen it also in India. In most of our countries, because that was not well developed yet, we had to use issues like campaigns, which were very successful in some of our countries, like mine, where we engaged a lot of community health workers and other sectors to engage in national campaigns, where people were, the communication piece was a key driver for that. And then, of course, was very helpful. But we have seen successful work, as you mentioned, UK, but also big countries like India had a very successful one in terms of using technology for the delivery, which was really instrumental. So that's something we need to work on now to establish in systems. It was very instrumental even before the vaccine for the testing and other issues in COVID. So building on that, the rate in the pandemic preparedness as we move forward, that's one of the key learnings that should be taken.
Okay, thank you very much. Lisa, two questions for you as the broader representative, if you like. The report says there should have been more consultation earlier. It was, on the other hand, set up in a hurry. How would you go about addressing that now? And do you think the criticism is right?
Absolutely. So in the beginning, I think everyone was responding at once. And as we know, coordination can be challenging. There was also different non-state actors, different civil society from different sectors. So the HIV community, the access to medicine community, who didn't have the language or the experience in immunization and vaccines. So put all that into a pot, and that makes something pretty hot. And what we find is that there was a lot of, we were very happy that Gavi had spent many years developing a civil society engagement strategy. And so the steering committee was able to work very seamlessly, as well as bring in those other partners. I think going forward, recognizing that different partners will bring different voice to the conversation about global health security and outbreak response. Better coordination at the country level and utilization of those existing networks, and really looking at who are our emergency partners, like WHO Global Health Cluster, like the GORN network, and going maybe outside just the vaccine space. I think that things shifted and became very coordinated then with regular civil society, COVAX partners, meaning WHO, CEPI, and Gavi calls almost every month. And then it spread out a little bit, and bringing up those country issues, bringing up issues of vaccine delivery, manufacturing, vaccine hesitancy. So We eventually, I think, got there, but there's always room for improvement.
Thank you very much. Just on a related point there, and it is tangential. I visited the Côte d'Ivoire as they took their first delivery of vaccines, and I was quite taken aback actually at the amount of vaccine hesitancy in the local population I met. And I think it's fair to say that we generally underestimated how quickly that would spread around the world. I don't know, do you have feedback and comment on that?
Absolutely. So civil society and other partners are involved at the community level in working on routine immunization. And that's, this is routine immunization week, and the launching of the report comes very timely. We need that trust in the community. You need that one-on-one relationship. You need the trust of your political leaders, and the great Minister of Health in Ethiopia, who has very good political will to combat vaccine hesitancy. And we sometimes like to call it vaccine confidence. So we can turn it around and say, protect your kids. And the messaging is based on social and behavior change science. It involves trust with the community, and it really should be practiced at every level, whether it's an outbreak response for COVID or something else.
Okay. Thank you very much. So Aurelia, to you, one of the report's criticisms, something that will certainly be picked up, is that in the first year, the year this report covers to December 21, we really only got out half of what we had planned to get out. And that happened because we didn't manage to establish the right deals with vaccine manufacturers, and indeed richer nations in some cases jumped the queue. Could you reflect a little bit on that? Tell us how you see that criticism and how in future you hope to overcome it.
Thanks, Paul. And I appreciate you picking that point up, because I think I would see it differently to the way that it's framed in the report, because the report frames it in a way to say COVAX fell short of its target of 2 billion doses in 2021. But I think that's not an entirely accurate characterization of our objectives. Our objective was to have 950 million doses go to lower income countries, the same amount to countries that were self-paying, and then 100 million to humanitarian populations. And if you look at the first one, which is really, for me, the most important one, because this is really about equity, we got to 1 billion doses in the advanced market commitment countries, so the lower income countries, in January 2022. So essentially a month behind. So I think that's a really important piece for me to be able to ground on, which is, did we get to our primary aim around serving the countries that were going to be left behind if COVAX didn't exist? And I would argue, I think we came bloody well short, sort of close to that. I think on the self-financing participants, what we saw is that, they were accessing doses from other sources. So in a way, it was, I think, fine to have them deprioritized. I think on the last one, this is one where, I think it's fair for us to put our hand up and say, on humanitarian access in terms of, fragile and conflict zones, I think we were less successful. And I think, in many cases, the host countries were reaching them through their regular mechanisms, but it wasn't true across the board. And so for me, this is one of the key areas where I think we have a lot of learnings to take from this pandemic in terms of how we get into some really technical, but really important questions like indemnity and liability waivers from manufacturers, to make sure that the next time around, it's not just about the first objective, which I think we did well on, which was equity between countries, richer and poorer, but also to this part in terms of within a country, the most fragile and vulnerable populations also having access.
I think that is a good point, and it's one I think that people miss a little bit. I was quite struck by the data as I was reading this report about the number or the proportion of healthcare workers that were covered relatively rapidly in lower income countries, and also the proportion of elderly groups. Is that right?
Yeah, and I think this is one thing that I think, you know, we take pride in making sure that, I mean, the really high risk populations, the healthcare workers, the elderly, there's a global average for healthcare workers, which is 89%, or sorry, high income country average 89%. You know, for COVAX, we got to 82%. That's a very, very solid number. I think one that's very close. Likewise, in the elderly population, we got to coverage of 69%. So I think making sure that the doses were applied where the need was highest, and ultimately to the number you quoted earlier, where it's going to save most lives, I think is one of the things that COVAX has managed to achieve with the countries, and making sure that we were supporting the country ministers like Minister Tadesse and others in really applying the doses where they were going to make the biggest difference.
Okay, so let me start to wrap up then. I'm going to go back to the 2.7 million lives saved over the entire period, so a little bit beyond this report. But I think it's worth reflecting on that number. It is an absolutely huge number. It is a lot of people. And for those who look at these data in a slightly cooler way, it's a number, I think, that tells you a bit about the economic capacity that is being saved for the future, and therefore the speed at which countries will continue to develop and hopefully prosper. I wanted to go through very quickly with each one of you a sort of a yes and a no to the question, should we be starting to plan the next COVAX this week, next week, or should we be thinking about something entirely new? Let's start that with Leah, please, from Ethiopia.
Question. I don't agree with starting entirely new. We already have a great learning that we've had with huge success and some limitations, obviously, which we may need to rethink on how it should be moving forward, but not to scratch off what was done and start new.
Okay, thank you. Beth?
Thank you. I mean, the answer is yes. You know, we have the 200 days mission, which is really being able to scale and distribute medical countermeasures around the world, you know, within 200 days of the start of a crisis. And there are already conversations about what that end-to-end medical countermeasures ecosystem needs to look like. It may not look exactly like COVAX, and certainly it needs to move beyond COVAX as well and beyond vaccines. But those conversations are already taking place, and they're building on a lot of the lessons learned that we see in this evaluation.
Thank you very much. Lisa?
I'm going with yes. Planning for the next outbreak, epidemic, and pandemic starts yesterday. We've built a good foundation, as well as brought in those different voices. And now let's start to think about where are the health systems aspects, not just vaccines. How do we train the workforce? How do we think of that community level buy-in on vaccines and outbreak response in general, wearing a mask? And how do we take care of our health workers? And so the next iteration to me would address all the issues in the report, but also think of these things I just mentioned.
Okay. Very quickly, Aurelia, I guess you're already planning for the next pandemic, are you?
Yes, absolutely, we are. And I think there's a number of learnings that we're already applying in terms of making sure that we have dedicated funding available from day zero, so that we hit the ground running. We don't do a repeat of spending the first couple of months of pandemic securing funding, looking at the resilience of the manufacturing base, particularly in Africa. I think those are the aspects that we already have plans and are putting work in place and I think on a number of different areas. And to come back to another point that you raised, which is, I think, an ongoing discussion around the risk tolerance, because we have these cycles of panic and neglect, and where we're not able to align on what's the risk tolerance that's needed. And I think those conversations are better made with cooler heads than in the heat of the action.
Okay. Well, listen, I'm going to wrap it up there. Thank you all for your time. It's been really interesting. And I'm looking forward to the work going on in future, so that we don't again have a month or two of panic as we try and put everything together from nothing. Thank you very much.